RANTAC syrup contains ranitidine. It is a medicine that is used to reduce the amount of acid produced in the stomach. This syrup is used in conditions such as stomach and intestinal ulcers, heartburn, gastroesophageal reflux disease, or GERD condition of acid regurgitation. Each 5 ml contains 75 mg of ranitidine. It should be protected from light and stored at a temperature not exceeding 30 degrees Celsius. It should not be frozen. The possible side effects of this medicine are headache, dizziness, diarrhea, skin rashes, muscle pain, tiredness, rapid heartbeat, nausea, etc. How to use this medicine? Take this medicine in the dose and duration as advised by your doctor. Check the label for directions before use. Measure it with a measuring cup and take it by mouth. Shake well before use. Rantac syrup mint may be taken with or without food, but it is better to take it at a fixed time. What if you forget to take Rantac oral solution? If you miss a dose of Rantac syrup mint, take it as soon as possible. However, if it is almost time for your next dose, skip the missed dose and go back to your regular schedule. Do not double the dose. How does this work? Rantac syrup is a histamine H2 receptor antagonist. It works by reducing the acid produced in the stomach. This helps to relieve acid-related indigestion and heartburn. The contraindication of this medicine: if you are allergic to this medicine or any of the ingredients of this medicine. Also, if you're taking any other medications, you must consult it with your doctor as there can be possible drug interactions.